Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO at CloudWave, Erik Littlejohn. Erik, how are you today?
Doing great. Thanks for having me, Jared.
Excited. Let's dive right in. Tell me a little bit about yourself.
Well, knowing that I wanted to establish a career in healthcare IT, I decided to go to West Point and major in U.S. history. That seemed like the smartest path. But seriously, served in the Army for a while. And then in 1999, as the first internet boom was happening, I decided a change of course was in order and wanted to take advantage of that and gravitate into the technology industry. So I joined Perot Systems, not knowing that that wasn't going to become the next Yahoo, but it sort of got me on a track with healthcare IT. And 24 years later, I can say that I've pretty much kept my whole career in healthcare IT and really enjoyed it.
Now we fast forward to today, right? CloudWave. Give us an overview of the company, where things are currently at today, the different areas that you're diving into, and then we'll kind of dig into some of the nitty gritty.
Sounds great. So our company's actually been around for over 30 years. For the first 20 years, sort of existed as a traditional value-added reseller focused on selling servers and storage and gear to the hospital provider market, serving the healthcare space exclusively. And then probably about 2011 and 12, a number of folks came over to the organization from Dell and other places and really had the vision of transforming the company into more of a managed IT services provider, doing cloud hosting, disaster recovery, backup. And really, over the course of the next 10 years, we transformed the company into just that and have over 100 customers that we're hosting in our cloud today. So we believe we're the largest independent hoster of EHR systems. That's excluding Cerner and Epic because they develop their own software and host a lot of their customers. But as an independent hoster, we're the largest out there. We recently are really excited because we added cybersecurity capabilities to the company in November of last year by acquiring Sensato Cybersecurity Solutions. And it's really been, I think, the next phase of our transformative journey.
What a great segment into what I wanted to ask you next, which is awesome. This is not a term. This is a scary term for many people when they hear it, right? Ransomware. In the healthcare space, especially, it's been a term that unfortunately has been more discussed, and you've heard more about incidents over the last couple of years, right? So that being said, talk me through why the fight against ransomware and these cybersecurity threats calls for a holistic cybersecurity approach.
Well, I think we're still kind of early innings, first of all, in understanding what cybersecurity threats look like. And so I think there's a pretty well-established pattern that we've seen escalate very quickly since, let's say, 2020 and the last presidential elections. There was all sorts of threats, and we saw tons of ransomware activity, phishing attacks, and organizations debating: are we going to pay ransom? Are we going to be down for 2 weeks and try to recover? And now I think that's starting to evolve, and people are starting to think about what's next. And so health organizations have started to take, I would say, the right first steps in adopting things like multi-factor authentication, looking at other, advanced technologies, MDR, SIMs, et cetera. Sorry, my light if I don't move enough, my light wants to go off on me. So, I think, people are continuing to ask of what's going to be next and how am I going to adapt or adopt to those sorts of emerging threats. And I just say one example of that, which I think we'll get into a little later, is around medical devices and how do I respond to those sort of threats.
Before we dive into that piece, most people, when they think cybersecurity, it's all about the reactive approach, right? Nothing really happens until something happens. So how can we shift from reactive cybersecurity to a more proactive strategy?
I think the first thing that's sort of paramount to that is really having an assessment done or doing an honest assessment of your capabilities and where you're at. So that's how a lot of our engagements will actually begin, is we'll do an assessment of an organization's capabilities. And we actually did this to ourselves when we acquired Sensato. And so what that'll do is take a holistic approach with NIST, HIPAA, high tech, and other frameworks, and really assess not only what type of tools you're using, what's the state of your policies and procedures. Also look at things like what's your plan for backup, what's your plan for disaster recovery. And so I guarantee any organization that does that assessment on day one is going to identify a lot of gaps and holes that need to be filled. And we sort of do this in a relatively simplistic way, and you'll see others do the same sort of thing of red, yellow, green, and it really becomes really a roadmap for the organization. We're finding a lot of these customers take this report to the board on a quarterly basis to sort of present the health, the cyber health, if you will, of the organization, and help sort of determine what steps need to be taken next. And we do the same thing with our board, and they're sort of expecting that we're continuously looking at improvements, investments, modifications, and adaptations we need to be making to an evolving threat. And I think that's really tough to do for healthcare organizations that might be, struggling to hire and retain talent. And so I think it's really important for there to be organizations like CloudWave and others to assist the market we serve. And so I think, we don't look at this as like just a one-time engagement, as more of a continual life cycle and long-term partnership with an organization. So as part of that process and being a customer of ours, we'll provide you templates to start on policies and procedures. Obviously, we can offer disaster recovery and backup solutions too, and that's why the acquisition made a lot of sense for us, because we think there's three legs of a proactive strategy to have both cyber or cyber coupled together with a good backup plan and a good recovery plan is going to position our customers in the best way possible.
When we think of medical devices, right, we rely as a society now so much on the medical devices that we use, right? Whether it's for ourselves or for our loved ones. So when it comes to security of those medical devices, why is moving beyond core infrastructure to encompass medical device protection such a must today?
Well, and I sort of go back to my last response that we're in the early innings, and so we've seen the attacks to date, and those are going to change. And so I think if you think about those attacks, it's very impactful to a healthcare system or a hospital, because their systems could be down, patient data could be breached, and those are all horrible outcomes. But I think if you start envisioning a hacker or a bad actor getting access and control of a medical device within a hospital, now you're talking about much more so patient safety, and the ramifications of those type of attacks are very concerning to all of our customers, to boards and senior executives across the healthcare landscape. And the really scary thing is there's a lot of organizations don't really have the process controls and capability of monitoring all of those devices. I mean, think about any experience you've had of all the things that are sort of connected, from IV pumps to other sort of monitors, and then think about what an attack on those type of devices might look like. We know that our customers are starting to think about these things and how they would respond to it, because we're getting requests for a lot of tabletop exercises and assessments so that customers can start thinking about how they react to those sort of attacks. And if you don't do that sort of ahead of time and try reacting to that sort of threat in the heat of battle, it's just going to be an absolute mess. You're going to miss things. You're not going to be as quick and responsive. And so the Sensato CEO, John Gomez, who's now our Chief Engineering and Cybersecurity Officer, always tells the story to our team, or tries to impart upon our team, like, just think about the patient safety element is the next step of the ball game here, and it's moving beyond the protection of data and systems into actually protecting patients' lives. And how can we have any better mission really as a company than to think of what we're doing impacting that?
My last question for you, Erik, before we wrap up here today is what's next for CloudWave that really excites you?
Well, I'm really excited now that we're 6 months into having Sensato on board, adopting that as our own platform to then combine that with the capabilities we have in providing world-class hosting, backup, and disaster recovery. So I think we have a much more robust solution to offer customers that allow us to enter some other markets and serve other hospitals that we haven't in the past. I think beyond that, I look forward to continue investing in the cyber security capabilities in particular, because I just can't think of a better space to be serving in and value to be bringing our customers. And I love the platform we have. We're so lucky to have John Gomez and his team as part of CloudWave, and to see how they can sort of bring those capabilities to what we've done over the last 20, 30 years as an organization, and just up our game and again provide a real comprehensive solution to customers that we couldn't do as well before as we've been evolving and investing in the business.
Well, Erik, I really appreciate you coming on, sharing your thoughts, talking through this recent acquisition, how it gives you that cybersecurity capabilities now, and hopefully we can have you come on in the near future. We can dive into some more topics, but once again, thanks so much for joining me here on the podcast today.
Well, thanks again for having me, and love to do it, and appreciate you taking the time.